Well, let's talk more about the hypothyroidism piece because this is something in the natural health world that if somebody has autoimmune thyroid, Hashimoto's, typically they're going to be told to avoid iodine. And according to
Down
your
in Michigan,
work,
they
it
won't.
is something to take proactively to prevent it and for treatment. And you have a personal story with both your daughters having that and using that as part of their treatment to regain their health. So I'll have you explain all that.
In the natural health world, what part of the, and I'm asking you this for a reason, what part of the natural health world is giving pushback on this idea?
To me, it's you know, the people I talk to on the show, a lot of the people writing the books that are New York Times bestsellers and that are getting out to the masses and trickling their way down, you know, the people from the US, Canada. To me, it's pretty much a consensus that other than your work, that if we have Hashimoto's,
I'm not the only one out
which
there.
even my wife has, so I'm pretty familiar with this. And we have thought that this is something we want to avoid, iodine.
So that stems back from, research, or it's almost like a wives' tale that's been put out there. But Hashimoto's was first described, I don't remember if it's the 1930s or 1940s. So where do you think Dr. Hashimoto was from?
I would say somewhere over in Asia.
That's what you would think, right? That's what I thought too. He's actually a German physician. So
there you go. Ignorance.
No, yeah. That's not ignorant. That's a little, I was not.
You tricked me.
I was not pimping you there, but it was just more to be a joke. But anyways, so Dr. Hashimoto was in Germany. It was after the introduction of iodized salt that he first described lymphoid hyperplasia in a thyroid biopsy and called it, Hashimoto's disease. So before the use of iodized salt, Hashimoto's was not seen. So that's how the whole idea that iodine causes Hashimoto's disease. And I have a whole lecture on this, and I go from the beginning to the present time, how this idea has just been perpetuated since then. So in Mayo Clinic, and there were two studies that went back. Mayo Clinic was one of them that looked back in time at thyroid biopsies before iodized salt and after iodized salt. And Hashimoto's was not seen in those biopsies before iodized salt. Now, we don't know if that's just because, maybe there weren't a lot of biopsies before iodized salt. I'm not sure of that. Or perhaps people just weren't checked for it back then. I don't really know. But Hashimoto's was only diagnosed after the introduction of iodized salt. So the appropriate question could be asked, is iodine causing Hashimoto's disease? Hashimoto's wasn't present before iodized salt. It's present after iodized salt. So, Jesse, do you have a degree?
Yeah, I have an undergraduate and a chiropractic degree.
Chiropractic. So you're a doctor. So you learned I don't know if we learned it in undergraduate, but we learned it in our doctor's school that association does not equal causation, right? You have to do further research with it.
For sure.
So, but it's the appropriate question is to ask. It's an association. So the idea that Hashimoto's is caused by iodine started from there. And really, that's where it took off. Because there was no interest in iodine as a nutritional supplement, because that was after the introduction of iodized salt, that's what took off out there in the literature. And there are case reports of putting people on iodine and they become hyperthyroid. Now, I have seen 3 in my practice of using iodine for about 30 years. In our total practice with 6 doctors, 6 practitioners, we see a lot of patients. I don't even know how many over that time period. A whole lot. We have 3 patients who became hyperthyroid from taking iodine, and it was quick when they started to take the dose. And what they had was an autonomously functioning nodule. What that means is they have a nodule somewhere in their thyroid gland, which sits in the lower part of the neck, right above the national championship sweatshirt that I'm wearing right now. And the when that iodine comes into play, the thyroid has lost its control mechanisms of making thyroid hormone. It's autonomous. That nodule takes up iodine and makes a lot of thyroid hormone, makes people hyperthyroid. if you do a radioactive iodine uptake scan on these people, they're going to get a hot nodule in that area, meaning it's taking up iodine fast and making thyroid hormone fast. For those people, they can't take iodine. They either get surgery and get that nodule removed, or they can't take iodine. And when they're exposed to iodine in larger amounts through food or supplements or something, they get a little bit hyper. So that's a contraindication to iodine. So unfortunately, those few case histories where that occurs, coupled with Hashimoto's only started after the introduction of iodized salt. And iodine, remember, after 1930s or so, when iodized salt was introduced, late 1920s or 1930s, there was no interest in iodine for anything in medicine at that point. So only the negative came out. And it just became sort of, gospel that iodine causes Hashimoto's and iodine can cause problems with the thyroid. I mean, look, I learned at med school, or it was taught to me in med school, and I was afraid to use it. And if you Google my name and some kind of statement that iodine is like putting fuel on the fire for Hashimoto's disease, you'll find it, because I said that somewhere in the first beginning part of my holistic practice when I eschewed the use of iodine. However, Hashimoto's only occurs, before again, the early 20th century and previous to that, Graves' disease was diagnosed in medicine, just not Hashimoto's disease. So guess what the treatment for Graves' disease was at that, early medicine?
Iodine.
And there's case report after case report after case report. Iodine was given, for Graves' disease, and so it was thought that iodine deficiency causes Graves' disease, which I can tell you it does, because I've treated lots of Graves' patients in my practice. We meaning my friend, my colleagues in my practice and myself, we like seeing Graves' patients. They're easy to treat holistically. And we have never sent a patient for radioactive iodine uptake treatment for Graves' disease. And I have sent maybe 2 patients in 30 years for surgery because we couldn't get their thyroid controlled. But I've never had to use radioactive iodine, which is a really dangerous treatment and should be the last resort for treating Graves' disease. But so the idea was out there that iodine caused Hashimoto's disease. So it was a reasonable question to ask, but the other reasonable question to ask is, well, maybe it's something else. Maybe it's iodized salt. Maybe it's the ferrocyanide or the aluminum silicate in refined salt that was causing this increase in Hashimoto's and Graves' disease. Maybe it was the exposure to aluminum and toxic halides like bromine that became, right around that same time. We'll talk about halides, but bromine became in use in medicine and became much more. Bromine toxicity took, started rising at huge amounts, right before World War II, and then it's continued until today and just gone up and up and up, which causes problems with the thyroid and problems with iodine. Maybe it's these things, but so let's move ahead now to the government's. I'm going to answer that question, and what I'd like you to do when you have these people on your show is you can ask them this question, because as Ricky would say to Lucy, explain this to me. Over the last 50 years, a National Health and Nutrition Examination survey is clear that iodine levels have fallen about 50% across the United States. Every 8 to 10 years, the U.S. government undertakes the National Health and Nutrition Examination survey. It's called NHANES, and they measure a cross-section of about 10,000 Americans for vitamin levels, mineral levels, toxicity levels, and they report the numbers, and we see sort of what's happening over a time period. And what you can see is a direct decline of iodine levels over this time period. Now, I'll ask you the question, since 1970, which is about when this NHANES stuff started, which is, 50, 5 decades or so. From 1970 to now, has Hashimoto's disease, has autoimmune thyroid disease gone up or down?
Up in a big way.
Huge way, an epidemic way. 30 years ago, when I was in my training, I didn't see much of this. If I saw a Graves patient or Hashimoto's patients, it was an anomaly, and it was really something. And wow, look at this. Now you see it in kids. As you brought it up earlier, I saw it in my kids. or my wife saw it first. We can talk about that. But so Hashimoto's and Graves' disease have gone up over the last 50 years epidemically, and iodine levels have fallen 50%. That's noted as a negative association. The negative association disproves the idea that iodine's causing this Hashimoto's epidemic that we're facing right now. Period. Exclamation point. It's over. That's not it. It's something else.
Okay, fair enough. But I want to clarify something before you continue here. What I was referring to before is that when you have Hashimoto's, you want to avoid iodine. I hadn't, up until your work, I hadn't come across anything about iodine increasing the risk of Hashimoto's. But what's known in the natural health world is that when you have it, you stay clear of iodine, which I know you're against. So I want you to get into that nuance.
We'll get into that. But before we get into that, I think we need to clarify this whole idea that it's in the natural health world. These people are not saying that iodine, they're saying that iodine causes Hashimoto's disease. They're saying that iodine worsens Hashimoto's disease. They're saying iodine causes Hashimoto's disease.
Okay. So not in my world, but okay.
Those naturopaths are saying that thing. I've heard them say it. So anyways, this negative association disproves the idea that iodine is causing Hashimoto's disease. So does iodine worsen Hashimoto's disease? Well, I can tell you, if that's your hypothesis, then you only need an N of 1 of anything. Hypothesis has to withstand all criticisms, or it has to be redone. So my daughters are 28 and 29 years old. They're physicians. They're working with me in my office, which is fabulous. And they were probably 10 and 11 years old. We're having dinner. And my wife says to me in the middle of dinner, "You think they got thyroid problems?" And I remember I had a fork or a spoon near my mouth, and I set it down and I put my hand over my forehead like this, and I'm like, "Oh, you're probably right." They've been complaining of headaches and being tired, and they were having these chronic headaches, just as their bodies were starting to change a little bit. And so I brought them in the office. I checked their blood work, and lo and behold, they both got raging Hashimoto's disease, titers in the 500s and TPO and thyroglobulin titers in the 500s or 800s. I mean, I wrote about it in my thyroid and iodine books. And so the first thing I did was put them on iodine, 25 milligrams, and they were 10 and 11 years old. So they were small adults at that point. And took gluten out of their diet at the same time. So it's not that we just did iodine. They were already off gluten before then because they had some problems with that on testing. And really what we did was really iodine because I already had them on nutritional support. And so when I lecture on this, I've got my daughter, they both showed the same thing, but I got Haley's lab tests over the years showing these titers going, starting up here and then here and then here and then here and then here, all the way down. And Haley's 29 years old right now, has no signs of Hashimoto's disease. Jessie, same thing, started up here, and she virtually has no signs of Hashimoto's disease. She's got titers like in the single digits, which is it's a little bit above the reference range, but it's not much. I would say you don't have Hashimoto's disease. Maybe I'm not 100% correct on that one, but so here's an N of 2, and I've got way more than that because I've done this with my patients. So it's my premise that Hashimoto's forms from low iodine, this dropping iodine level at the same time in these 50 years that we've had these rising halide toxic levels has caused this Hashimoto's disease, and the treatment for it is iodine, which will correct iodine deficiency and cause the halides to release from the body.
Okay, just to summarize what I think you just said there. So not only does iodine not cause Hashimoto's, the lower iodine we're taking in as a whole is a contributing factor to Hashimoto's, and part of the treatment is to make sure you're upping your iodine or getting a sufficient amount, I should say. My experience after 2.5 decades, over 2 decades of using iodine and treating, I'm assuming between me and my partners, thousands and thousands of patients, is that Hashimoto's isn't that hard to manage. And my kids have no signs of it now. So, ask those people, explain that one. Their hypothesis needs to be redone. If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We've tested over 8,000 people in our office. Over 97% are deficient in iodine. The vast majority is severely deficient in iodine. All thyroid hormone can't be made without iodine. Thyroxine, or T4, has 4 atoms of iodine attached to thyroglobulin. Triiodothyronine, or T3, has 3 atoms of iodine attached to thyroglobulin. In fact, any hormone...